Hi, I'm Dr. Judy Morgan, author and veterinarian, and today I would like to talk to you about pet vaccinations. For years, we've been taking our pets to our veterinarians annually and vaccinating them for every new disease that comes down the pike. In my opinion, this is not necessary, and new research has shown that the vaccinations may actually last the lifetime of the pet. Puppies should be started on their first vaccinations between 10 and 12 weeks of age, and they should not be taken from their mother until at least 10 weeks of age. When you buy puppies from pet stores, they are commonly taken from their mother as early as 5 to 6 weeks of age and started on vaccinations. They're vaccinated weekly until they are purchased, and then once they go to the regular veterinarian, they may be vaccinated 2 to 3 times more. This is very, very stressful for their immune system and is setting them up for a lifetime of problems. So my recommendation is do not buy your puppies young and do not allow them to be vaccinated early. The core vaccines that are given to puppies include the distemper, adenovirus, and parvovirus. Distemper vaccine probably lasts the lifetime of your pet. So if you follow my protocol and give the puppy the first vaccine between 10 and 12 weeks of age and the second vaccine between 14 and 16 weeks of age, then my recommendation is to do a titer when the puppy is about 6 months old and make sure that they are protected for the distemper virus and that they have circulating antibodies in their system. I'll repeat that titer again about 12 months after the first one to make sure that everything is holding. Some veterinarians require annual titers, and some kennels will require an annual titer to allow your pet to be boarded. For my own personal pets, I've been doing titers every year, and I have not had to vaccinate anyone in the past 8 years. The second part of that vaccine, the DAP, is the adenovirus, which is also known as hepatitis. Hepatitis does last the lifetime of the pet as far as the vaccine goes, and so you don't need to titer for that, and it is not normally done. The parvovirus is probably the most important part of that vaccine series, as parvovirus is still a big-time disease in this country, and it is much more common in the hot, humid weather, so down in the south, and in our area in the summer, it crops up and becomes a bigger problem. So I do recommend the same protocol as far as the vaccines and the titers, and again, in my own pets, I have not had anyone need a parvo vaccine in the past 8 years. At some point, their titer may dip, and maybe I'll consider vaccinating again. However, there is controversy over the potential for memory cells, which are immune cells in the system that may kick in when the pet is exposed to the disease, even though they have a low antibody titer. So that's up to the individual as to whether they would boost at that point. Another vaccine that is commonly given, and I do not recommend very highly, is the Lepto Vaccine. Leptospirosis is actually a spirochete. It's not a virus like the distemper, hepatitis, and parvo. A spirochete is more similar to a bacteria. The leptospirosis vaccine does not last a lifetime. As a matter of fact, it probably only lasts 9 to 12 months. The Lepto vaccine includes 4 serovars, or types of lepto that your pet can be exposed to. There are actually 7 common leptospira serovars that can make our pets ill, but the vaccine only covers 4. Leptospirosis is spread through the urine of wild animals and dairy cattle, most particularly skunks, fox, raccoons, and rats. So my recommendation is don't take your pets around stagnant water and areas where those wildlife might be found. For city dogs, the rat problem may be a bigger deal. Leptospirosis is found in certain pockets in the country, and you can check maps online to see if you live in a high lepto area. However, when I checked that map, I found that New Jersey was considered a high lepto area, and I have only seen 4 cases that were confirmed in 31 years. So I have to wonder, is it as commonplace as the vaccine companies would like us to believe? I do not vaccinate any dog less than 10 pounds for leptospirosis because it is a highly reactive vaccine, and most common reactions are seen in those small dogs, and I will not vaccinate my own dogs for lepto. Lepto is something that people can catch. However, in the cases that I have seen, I haven't had any human problems with it, but that is something to be aware of. Bordetella vaccine is another controversial vaccine. Bordetella is kennel cough. And the vaccines that are on the market include Bordetella, parainfluenza, and sometimes another virus or two thrown in there. There are actually close to 60 different upper respiratory viruses that your pets can catch at the kennel that would be considered kennel cough. So the vaccine is only protecting against a small part of those things that they could be exposed to. One of the problems with the oral or intranasal kennel cough vaccine is that the pets can actually shed the virus and become symptomatic, so they actually get the disease from the vaccine, although it's probably going to be a mild case. A good kennel will not allow your pet to receive an oral or intranasal kennel cough vaccine within 10 days of going to the kennel because they can shed the disease and become a bigger problem. My recommendation is to use a kennel that does not require the vaccine and that has good ventilation and good sanitation. Personally, I have a pet sitter who comes to my house. I'm very lucky. Other vaccines that might be considered would be coronavirus. Coronavirus is also known as yellow diarrhea, and it is most commonly seen in puppies in crowded, unsanitary conditions. I do not give the coronavirus vaccine because it is usually not something that is deadly, except in very young puppies where they can become dehydrated. Again, good sanitation, good housing will solve that problem, so I don't see it as a problem. The influenza vaccine is cropping up in the news lately because of the Korean dog flu that's popping up around the country. The influenza vaccine that is on the market will not cover the Korean dog flu. The vaccine was for the dog flu that came up through the greyhounds from the racetracks in Florida about 5 or 6 years ago. So for me, using an influenza vaccine that's 5 or 6 years old and covers a different virus than the virus that is now seen doesn't make any sense. It's kind of like saying to people, well, we didn't feel like making a new flu vaccine this year, or we didn't have time to make a new flu vaccine, so we're going to use last year's and hope that it gives you some protection. So I am not using the influenza vaccine, and the influenza outbreak seems to have died down at this point, thank goodness. Lyme vaccine is another controversial vaccine. It may cause more problems than it solves. I only recommend it or will use it in hunting dogs and dogs that are going to have a very high tick exposure. The vaccine probably is 60% or less effective in pets that have already had Lyme disease or Lyme disease exposure. So if you're going to use it, you should start with puppies when they are 10 weeks old, give it at 10 weeks and about 13 weeks, and then you would have to do it annually, we think, but we don't really know. There is no titer test that is good for the Lyme vaccine. However, the test that I am using for pets at my office right now, I have some dogs that were vaccinated for Lyme vaccine back in 2008 and have not received one since, and the test comes up with detection of Lyme vaccination antibodies. So that tells me it's still running around in their system. I don't think these dogs need to be vaccinated every year. I think that research will show that. As far as the kitty cats, the panleukopenia is very similar to the dog distemper. I recommend 2 vaccines as kittens, again between 10 and 12 weeks and 14 to 16 weeks, and the same titers. I do not recommend feline leukemia vaccine unless your cat is out in a very high-risk area. For indoor kitties, they have no exposure. You should be testing new cats before you bring them in the house. So your cats would not have exposure to that. Do not allow your indoor cat to be vaccinated for feline leukemia. And their distemper vaccine, once they get through that kitten series, they probably never need to get that again either. The vaccines for FIP, FIV, feline ringworm, all very problematic, should not be used. For the dogs, the Giardia and Porphyromonas vaccines, again, very problematic, do not recommend them at all. Rabies vaccine lasts for 1 year the first time it is given, no matter how old the pet is when the vaccine is given. The second vaccine that they are given will last for 3 years. That first vaccine, they have to be 12 weeks old before they can receive a rabies. So the second vaccine is good for 3 years, no matter when they receive it, and no matter how long it's been since the first vaccine was given. Do not allow your veterinarian to give you a rabies certificate that is dated for 2 years. There is no such thing as a 2-year rabies vaccination. You have a full 3 years from the time the pet is given that second rabies vaccination. Rabies is a problem because it is zoonotic, which means that people can catch the disease when they're bitten by a rabid animal and there is no treatment and people die. That is why our government states that pets must be vaccinated for rabies, and I think that's probably a good thing. However, in the state of New Jersey, I can write rabies exemption letters, which I will write for pets with cancer, pets with severe seizure disorders, pets with immune systems that don't function well, or pets that have had a severe allergic reaction to the rabies vaccine in the past. The Rabies Challenge Fund study is studying how long the rabies vaccine actually lasts, and we think that it may last a lifetime. It certainly may last 5 to 8 years. But until the study is completed and we can prove that the vaccine lasts longer, we are bound by the laws that exist right now. But don't allow your pets to be over-vaccinated. And certainly never allow your pets to be vaccinated when they are sick. If they go into the veterinary office for something that is an illness or are hospitalized or are having surgery, that's not the time to vaccinate your pets. Spread your vaccines out. Give one vaccine at a time. Make all vaccines be given 2 to 3 weeks apart. Yes, it requires more trips to your veterinarian, but it is so important for the health of your pet. I hope that this gives you some needed information. If you want further information or have more questions, want to delve in a little more deeply for the vaccines, then please get a copy of my book, From Needles to Natural, and it is available on my website, www.drjudymorgan.com, or on Amazon. Have a great day.